Hello, Miss Jalen Wilborn. My name is Dawn Williams. I'll be your nurse today. How you doing today? Good. Okay. I'm going to shut the door to provide you some privacy. Okay. What I'm going to do first is wash my hands. And could you tell me your name and date of birth?
Jennifer Wilborn, September 28th, 2000.
Jaden Wilborn, September 28th, 2000. I'm making sure I have the right patient. Okay. And I'm going to be doing a head-to-toe assessment on you today, if that's okay.
Yes.
And do you know, I'm going to get you to answer a few questions for me first. Do you know where we are?
Fayette County Hospital.
Do you know the date and time?
September 10th, and the time is about 8.
Yes. Do you remember my name?
Dawn Williams.
Yes. And do you know what we're doing today?
Assessment.
Yes. Good. Okay. And what I'm going to be doing, I'm going to be using a stethoscope and a pen light to do this assessment. Okay. What I'm going to do first is I'm checking the symmetry of your eyes, make sure they're equal. Checking your facial symmetry, make sure everything's equal and straight. Checking your ears. Okay. And so I'm going to shine this light from my pen light in your eyes, and I'm going to check your pupils. Okay, good and constricting. And so what I'm going to do next is I want you to look at my pen light, and I'm going to check for accommodation. When I bring it close to your face, your pupils are going to constrict, and when I move it away from your face, the pupils are going to dilate. So I'm bringing it close to your face and moving it away from your face. Good accommodation. And what I'm going to do next is I'm going to check your nose. Make sure you don't have any kind of drainage. Make sure everything's patent. You breathing good? Anything wrong with your nasal passages?
No.
Okay. Next thing I'm going to do is check your oral membranes. Make sure everything's pink, moist. Everything's pink, moist. No lesions, no cavities. Everything's fine. I'm checking your lips for cracks and in different areas, cracks and lesions. Okay, your lips are good. And now I'm going to check your ears. Make sure everything's okay. Okay. All right, I'm checking this ear. Everything seems to be good. And the next thing I'm going to do is I'm going to check your head. And when I check your head, I'm checking for the shape. I'm going to check for any infestations. I'm going to check and make sure there's no draining. I'm going to wash my hands. Okay, I'm going to put on my gloves to check these certain areas in your head. Okay, what I'm going to do next, I'm just going to pull this back a little bit. Checking for shape, bumps, looking in here for infestations. Everything's good. Nothing in the back. No drainage. Okay, you comfortable in this position?
Yes.
Okay. So what I'm going to do, I'm going to take my gloves off. I'm going to throw them away and wash my hands again. The next thing I'm going to do is I'm going to check your range of motion in your head and neck. Could you turn your head from side to side? Okay, good range of motion. Next thing I'm going to do is I'm going to check your upper extremities. I'm going to check your arms. Okay, I'm looking at the skin on your arms. Everything is clear. No scrapes, no bumps, no bruises, no scars. Okay. And now I'm going to check for swelling. All right. The next thing I'm going to do is I'm checking your fingernails. I'm going to check your nail beds for capillary refill. Okay, good and brisk. Okay. Next thing I'm going to do, I'm going to check your radial pulses in both arms. Check your radial pulses by that. Okay, we're good and strong. I'm going to get you to grab onto my two fingers. Hold on tight, and I'm going to get you to pull so I can test your strength. Okay, you got good strength equal in both arms. All right. And now what I'm going to do is I'm checking the tip of your hands. They're good and warm. Color and everything's good. And what I'm going to do next is I want you to close your eyes. And I want you to tell me what I'm doing.
You're rubbing my pinky finger
On which side?
my left hand.
Okay. And could you tell me what I'm doing and where?
Rubbing my right thumb.
Yes, good. Good sensation. Okay. Can you can open your eyes now? And what I'm going to do is I want you to raise your arms. Hold them down. Turn your wrists. Straighten them out. Okay, good range of motion. Your upper extremities. Okay, what I'm going to do next is I'm going to check for your heart tones, okay? And I'm going to be checking down the mid-clavicular side. And I'm going to be checking in the fifth intercostal muscle. And this time I'm going to be using my stethoscope. And when I listen to your heart tones, I'm going to listen for 1 full minute. What I'm going to do is I'm going down to your breastbone. And I'm going to use the back of my hand to lift your breast. Okay. It's good and strong. And I got 84 in your 84 pulse. Okay. What I'm doing is I'm checking your chest for any kind of scarring, any kind of areas, abnormalities, any kind of ports. Nothing noted. Skin's clear, all good. And I'm going to check your skin turgor to make sure you're not dehydrated. Okay. Everything is good. All right. And what I'm going to do next is I'm going to listen to your heart sounds. And I'm going to listen in 6 places in the front. And then I'm going to tell you raise up and I'm going to listen to 6 places in the back. All right. And when I listen to your heart sounds with each placement, I want you to take a deep breath in and blow out with each placement. Okay? Deep breath in, blow out. Deep breath in out. Deep breath in and out. Deep breath in and out. Deep breath in, out. Okay. Other side. Deep breath in, out. All clear. Front lobes clear. And I'm going to get you to sit up. I'm going to help you sit up, and I'm going to listen to your back. And I'm going to keep it, you can keep it covered up to provide privacy. Okay. And I'm going to listen to 6 places on your back also. When I place them, I want you to take a deep breath in just like I did before. Okay. Deep breath in and out. Deep breath in and out. Breath in and out. Breath in and out. Breath in. Breath in. Okay. And I'm also, everything's clear. All's clear and good. And I'm checking the skin on your back, and I'm making sure you don't have any pressure ulcers, any kind of scrapes, bumps, and bruises, or anything since you've been laying on your back. Okay, your back is clear. So what I'm going to do is get you to lay back down, because my next thing I'm going to check your belly. And I'm checking your stomach for, I'm checking for bowel sounds and for quadrants. And the first thing I want to do is I'm going to inspect your stomach for any scars, any kind of distension, and the shape. All right. So I'm visually looking at it. I see no scars. I see no out of ordinary distension. And the shape is good. Okay. And the second thing I'm going to do is I'm going to listen to your bowel sounds. And I'm going to warm the stethoscope up first because it'll be a little cold. All right. And I'm going to start in the lower, right lower quadrant. Okay. And I'm going to end in the left lower quadrant. Okay, good. Bowel sounds active in all 4 quads. Okay. So now what I'm going to do next is I'm going to palpate your stomach, and I'm going to check for masses, any kind of abnormalities, and let me know if you feel any kind of pain or tenderness, okay? All right. I'm going to start in the left, in the right lower quadrant. And yep, it might tickle. Feel any kind of pain?
No.
All right. Okay. I feel no lumps, no masses. I'm checking in each quad. Okay. All right. Everything's good. So I'm going to cover you back up now to provide you some privacy. And the next thing I'm going to do is I'm going to check your lower extremities. When I check your lower extremities, the first thing I'm going to do is inspect your skin, and I'm going to check the swelling. I'm going to uncover your legs. Okay. So I'm visualizing the skin on your legs. I see they're all clear. Skin normal. Okay. And now I'm going to check for edema, and that means swelling. Okay. Okay, good. No swelling noted. Okay. And what I'm going to do next is I'm going to check your capillary refill in your toes. And I'm checking them in both feet by lat. Okay. Capillary refill good and brisk. Less than 3 seconds. Okay. And the next thing I'm going to do is I'm going to check your pedal pulses by lat. I'm going to check them in both feet. Okay, your pedal pulses are good and bounding, strong, and equal on both sides. And I'm going to check your posterior tibial pulses. And it's going to be like on your inner ankles. Okay, they're good and bounding, equal on both sides. All right. The next thing I'm going to do is I'm going to check the temperature of your lower extremities. Okay, they're nice and warm and dry. Okay. And what I'm going to do next is I'm going to get you to push against my hand because I'm going to test your strength in your feet. Okay. Okay. You got good strength in your feet by lat. Okay. And what I'm going to do is I'm checking the range of motion in your legs. Okay. I want you to flex your ankles and rotate your feet. Good. I want you to bend your knees. Okay. Good. Can you raise one leg up at a time? Okay. Good job. Good range of motion. And I want you to close your eyes again. And then I want you to tell me what I'm doing and on which side.
I think my foot on my right side.
Yes. And I want you to tell me what I'm doing now.
Just tapping my left foot.
Good. You have good sensation in both lower extremities. Okay. And so what I'm going to do now is I'm going to cover you back up to keep everything private. And I'm going to raise your side rails up and make sure your bed is low. And make sure your collar light is within reach. So just in case you need us. And I'm going to wash my hands then. Okay, Miss Jalen. Is there anything you would like to ask me before I go? Is there anything you want to know?
Do you know anything about breathing techniques to help with anxiety?
Anxiety from being in the hospital? Okay, yes, because everybody that comes to the hospital is anxious. I do know a little bit about some breathing techniques. One thing I've learned is you have a technique to where you breathe in, take deep breaths in, and you breathe out. You breathe into your nose, and you breathe out through your mouth, and you repeat that at least 5 times. And what it does is it'll bring your blood pressure down. It helps resolve. It doesn't resolve anxiety totally, but it helps subside some of the anxiety, and it helps bring oxygen into your lungs, and it helps that oxygen flow through your blood. And at that point, you just start relaxing. And I know one thing, since a lot of people actually got breathing techniques and a lot of people have anxiety in the hospital, I actually have some paperwork printed out on that. And I would like to give it to you if you want it. Okay. This is what I have right here. And you can also read it now or you can take it home for later for next time if you come back. But while you're here, it's good to read it now. So while you're staying here, you can practice these breathing techniques. And if you want, when I come back to check on you later on, we both can do the breathing techniques. Okay. All right. There's your paperwork. Okay. And what I'm going to do is make sure everything's clear and good. So everything's okay. And I will come back and check on you later, okay?
All right.
Thank you.